they are asadhyas. Still, maybe because the asuras or rakshas are harmful, they may kill because no insight is there. Person is not knowing himself what he is doing or he is not doing, what he has to do or to do. So you have to treat him by the upayas first. Vada, bandha, tarjana, trasana, etc. are mentioned as upayas. These are upayas because by application of these you can control them. By tying, you can control the person who is going to injure or harming others, killing. Many people comes with weapons, so you can at least control them. After controlling, after vada, bandha, or it is not vada means killing, threatening by Rajapurushas is mentioned, by police people or the faculty who is having stick in their hand or because see I will beat you. Just that is enough to control. So vada, bandha, tarjana by scolding, trasana making afraid of. See, I will put this stick into your mouth or with this particular fire I will hit you. So such things you can control these category. Even this may be required even in the doshaja unmadha conditions also, where pittaja unmadha, person is excessively himsraka, aggressive. There also these upayas are required to control the patient. It is not the treatment. You remember that these aspects are not treatment. They are controlling methods of the patient. So by these upayas, you can control the patient. Then you have to apply yuktiyapashya chikitsa there or daivapashya chikitsa as per the condition, as per the requirement. This is what in brief the doshaja unmadha and agantaja unmadha treatment what we can do. And in addition,
any questions?
Sir, namaste. We understood that chikitsa can be done for agantaja unmadhas and all such things, but these are in terms of adults and the age-old people. But what if these conditions are in young children? Because of late we have been seeing such cases coming up. Can the same procedure and the chikitsa, everything can be done in children also, and the same medicines and same sattva chikitsa and devapashya chikitsa can be incorporated for treating children also?
Yes, the treatment remains same, but maybe the method what we adopt should maybe different, because in children not that much bhaya chikitsa is not required. Sometimes bhaya chikitsa itself is sufficient in children. If we, because we had treated several conditions where pseudo or paralysis conditions or pseudopsychosis conditions where we treated with simple bhaya darshana chikitsa by patient, maybe because of some family problems or some attention seeking disorders are very common in children. They should seek the attention, that is rati archana or rati akamshi you can say. So patient, they add like having severe abdominal pain or severe dragging the legs, like paralysis or some severe pain in particular areas. So, and if you properly understand the condition, the mental status of the patient, and if you do, that's I am going to do surgery now. You need not do, but taking him to OT itself is sufficient for as a treatment. and by just we had treated just by simple Agni Karma. See, I am going to do by this, your leg will be alright. But patient, by a fear of that Agni Karma, patient become alright. Sir, I am alright, I am able to walk now, run now, and she ran also. So such simple techniques are there, which are mentioned as upayas, that itself sufficient in the children also. But we have to analyze, this is what actually which condition is. And sometimes in Balagraha what is mentioned is some severe conditions are mentioned in Balagraha, but that some severe neuropsychological disorders, etc. That you should not misinterpret that. You have to understand the condition and then treat. So some are very simple conditions where like attention seeking disorders, dissociative disorders, etc. So that you can treat with these upayas. There are some other conditions where Parishad Chikitsa, maybe the Parishad Chikitsa, that the Bali, etc. mentioned in Balagrahas, that is having scientific reason also. So that the Parishad Chikitsa and Parishad in combination comes. Okay. Sattva some only this Sattva Chikitsa. Simple. Ashwasa, Surata, etc. it mentions that. So that itself is sufficient. So in that way you have to treat. Okay. So understanding the condition is most important. Then you can treat. In all conditions, that understanding Ayurveda first and then treat. Okay.
Thank you.
Especially when it comes to children, we have to understand few conditions like as I was mentioning. Especially there are different types of neurodevelopmental disorders which need to be understood, like they have ADHD, autism, other cerebral palsies, and all which really are like more of a neurodevelopmental disorders which only a multi-model or a multi approach is required. Like you need therapies, you need medicines, you need speech therapies, you need occupational therapies, physiotherapy, you need that kind of therapies. Others like which you should not listen is about different infectious conditions which are very common, which also could have a psychological manifestations. There are very less chances that people develop psychotic disorders in children, very less chances. It's more of a neurological presentation that they have, like maybe learning disorders, behavioral disorders, like habit forming disorders, like they have aneurysms, bedwetting, or doing the fetus during the bed. It's very, very common. So these are the conditions which probably has a lot of developmental scenario to be evaluated, like what exactly is the cause. And most often there could be some form of fear, which is always associated, fear with parents, teachers, conditions. Sexual abuse, physical abuse could be there, which again can be one of the major causes for such manifestations. So in these conditions, apart from the medicines, of course, when you do Sattva Chikitsa, you also need to take the family into consideration. The parental counseling is also equally important along with the child.
Namaste, sir. In Amanushopasaga Pratisheda Adhyaya, many Nayananjanas are mentioned, sir. What is the role of these Nayananjana in Graha?
See, in Unmadha Chikitsa itself,
Sir, what told the Narayan Prakash and Suhas Shetty sir is correct. The treatment for children, there is no separate entity or method for treatment. Treatment will be the same, but the changes will be first the physician who is treating has to understand whether this child it is really having problem or karma. First you have to identify. It is your duty, isn't it? Many the children they will come. See what I have seen, what I have heard, and what I have treated. The mother will bring the child. Sir, he is going to the school, 4th standard. From Monday to Saturday, he is having problems, sir. loose motion, fever, headache, everything is there. But Sunday absolutely is already, sir, what is the problem? See, this is the one. By making a proper history from the relatives and then later on you have to examine the patient. When you take the history, you have to analyze whether it is really drama. What is your problem, sir? Continuously I am getting abdominal pain, sir. How much it will be? Sir, I am tolerable pain, sir. I can't sit in the class and I can't take the tiffin. What the tiffin box is given by my mother, I am not able to take. When it will be subside, after 4:30, gradually it will subside, sir. Then again morning, early morning by 7:30 it will subside. See, these are things. Here, how to treat? You don't give him much treatment here. Sattva Chikitsa is also required, what the sir told. And the patients come with leg pain. Whenever I go leg pain, okay, we'll do these things, Dagri Karma or other the technique, the Bhaya, which will be shown this. But actually you don't do that. If you have done for 7 days, not for 1 week, you don't go for school. Every day you have to come, we will do this procedure for your leg. No, sir, I will be alright, sir, but tomorrow, next day you will become alright without any treatment. That's good. And patients come with like abdominal disorders. You have to give the Ichthyopasaya Chikitsa, which doesn't, like a placebo you have to give and tell the parents, see, I have given the medicine, he will be alright. And you tell him what sort of treatment we will give. The Bhaya what he told, that you should be created him. Then he will understand, he will gradually from Monday to Saturday also all the problems will go. Not only Sunday, Monday to Saturday also problem will go. This is the technique you have to adopt in your practice, and examination and history taking is very important. The what treatment we are suggesting, that is not important. Either the treatment will be Ichthyopasaya, Devapasaya or Sattva. Among these three only you have to do, isn't it? The treatment really he required, or it is he doesn't require any treatment. That you have to, first you have to diagnose this one, then the diagnosis of the disease later on. Okay.
See, in Ayurveda, the beauty of our Rishis is they had not left any route. They had utilized every route for the treatment. For dosha niraharana as well as vyadi shamana, they had utilized every routes. Where they know the pharmacology very well regarding all these medications. That's why see the dermal application, all your upanaha, abhyanga, pradeha, all these, because 30% of absorption is there. That's why in Unmadha also these pradehali chikitsas are mentioned. And even from the anjana, the absorption is more. The Tishna dravyas are mentioned to apply. So that Tishna dravya, in minimum dosage is sufficient. So person won't take. Even the dhupas are mentioned. Tishna dhupas with Tishna Aushadhis as well as Sarpani, Moka, etc. is mentioned. The inhalation of that is because person won't take the medicines, but tie him in the room and put this. The treatment is over. Tie him, put the anjana, at least that you can do. Or some application over the shiropichu or shirotalam, etc. So that simplest form the acharyas has given, but utilization is important. How to use and how to utilize this. Because almost, not only the Navarandhras, even all the Randhras, they are utilized for the treatment. That's why Anjana, Nasya, Pradeha Ussadana, Dhupa, Dhumrapana, all these are come as treatment. Because, see, if this is not possible, at least this you can try. So, orally patient is not taking. So, do inhalation therapy or give fumigation with these medications. He will inhale, and because he can't hold the breath, you should go. Or in the anjanas also like that, teach anjanas, because minimum dosage is sufficient there. If you apply, that will absorb into the circulation and treatment is over. So that's why in all these, wherever the oral is not possible, that such treatments are mentioned, and even in the Snehapana etc. also. Pravicharana, see the highest Pravicharana Sneha is because sometimes patient is reluctant. I won't take the Acha Snehapana. Many are, it is not psychiatric patient, even the other patients also reluctant for Snehapana. Because how many of you can drink do Snehapana? Raise your hands. How many of you can do Snehapana? If I give Mahatikta Jagrata, how many of you can drink? Okay, so number is less. So even obviously the society is the same. So that's why. So if that particular Krita preparation, if the Snehapana is not possible, you can utilize in the form of payasam, in the form of kheer, or in the form of laddu, in the form of whatever we prepare with that, give. So Snehapana can be done like that. So Pravicharana Sneha can be utilized. So because everybody cannot drink Sneha, so such things you can do. So where it is not possible, even we can give the Arohana Basti also. Then we can. So in that way, the Acharyas has given a number of opportunities to you, or whichever is patient feeling better or patient friendly, that you can utilize. Okay, it is what the options has been given to us. So whichever the patient likes, you can, or whichever is that you can feel, okay, this patient is reluctant for oral medications, do these applications, give me Pradeha or Upanaha or like that, or Shirotalam, Shirobichu, Shirodhara, or other treatments methods are there. According to the requirement, you can utilize. Because this option, specifically in the Unmadha, these options we have to use, because every patient is not willing for the treatment, or any patient tells, I am alright, you are mad, or you are giving treatment to me. This is what in the schizophrenics or severe bipolar type 1 patients, they come and tell, already diagnosed with a sample. Sir, I am alright, why these medications are for me? My mother is not alright, she is always telling bad about me, she should be given treatment, why the medicines are given to me? So this is what we are facing in psychiatry. Okay. So such every options you can utilize for the treatment.
Namaskaram, sir. When it comes to tadvidyasambhasha chikitsa, although we know it is having absolute result, but we can't explain to our patient what it is exactly. So आपको कभी ऐसा हुआ है कि पेशेंट को समझाने में दिक्कत आ रही हो और पेशेंट को आप कैसे कन्विंस कर रहे हो कि it is the best option for you? So can you give us some examples?
Yeah, thank you. Specifically in Narayan Prakash, see, you can give examples of mantra, etc. These are now proven, even the Havana Homa also. But other, if the patient is it's all belief. If the patient is believing that by this, you have to study his culture and religion also. Because for a Muslim patient, you can't advise Mrutyunjaya Homa, or for a Christian, you can't advise Dhanvantari Puja or Rudra Puja. So, according to their religion and belief, this Tadvidyasambhasha Chikitsa is based. Okay. So, it is having innumerable energy or uncountable energy, but utilization, to whom you have to advise, who is having that belief in his culture. So that you have to advise that. So by considering that, you can. Sometimes I advise these for the Muslim patients, I advise to do 5 times namaz properly. Do that. And for the Hindu patients, I advise to read or chant Vishnu Sahasranama regularly, Lalita Sahasranam regularly, or other their mantras regularly, and do these particular homas or havanas. Like that I advise. But it is not to all. As per their religion, I advise. And for Christians, I ask them to do some prayers in the evening or morning 2 times regularly. So by that, because their faith will improve. they heal themselves. So along with the Yuktiyopashaya, this Devapashaya advice in many conditions. But sometimes, even apart from the religion, sometimes this Devapashaya, even doing the home of pujas, advice to the other religions also. If they believe, if their family members believe, because the person doesn't know. If their family members believe, so I advise this, if you do or if you go and do prayer there, that particular effect will be there. So you can, so I give options. If there's many families agree to do, and they get benefited also. So this choice you have to give to them, because you can't say, sometimes this this question of conversion etc. also comes if you advise directly. So you have to convince them. Then you have to. So, but effect definitely will be there. You have to see. Even sometimes I advise for the Christians. I advise that 2-3 churches are there, specifically where they do mass prayers etc. There they go and they do. And in church mosques, so this specifically psychiatric treatment. Many mosques are famous. I think near to Hubli Ayurved College, one mosque is there where even the Hindus also go and they do some things there, and they will be alright. And sprinkling the water, hitting with this some sticks or feather of this peacock feathers. All these are there in our culture. So this really effective because it affects the person's mind. He himself feels, so by this I am alright. So such things come. Okay. So this Devapashaya you can't say this is affected to him, this maybe and not. Okay.
This is the last question, sir.
Namaste, sir. Sir, how should we understand the term of the word Sattvavajaya? Is it to control the mind or to conquer the mind? Because in Shloka they are told, Sattvavajaya punaha aitevyu arthevyu mano nigraha. And I have another question, sir. Is Sattva, Cheta, Chitta are all synonyms or with same meaning? If they are not different, why they have given Sattvavajaya? Why not Chittavajaya or Manoavajaya?
Thank you. Sattva avajaya. Avajaya is upliftment. So, manas, which can be uplifted. Okay, your body cannot be uplifted. Can be lifted. Okay, manas can be uplifted. So, sattva. Sattva here, it also applies to sattva guna of the manas, which can be uplifted. By uplifting the rajas and tamas, definitely will be diseased. So that's why sattva avajaya is sattva guna avajaya. Along with the manas, which is the dominant guna, should be sattva. That's why sattva avajaya, not the cheta. Cheta is chetana avastha of the manas. So chetana, chetatva or cheta, chitta, it is related to chaitanya of the manas, related to atma and manas combination there. Okay. So here in the sattva guna, it is not in the dead person, it is not done. It is done in the living persons only. But that chitta or chetana is given, or chitta is given to the combination of sattva or manas and atma, whereas this sattva specifically guna related. That's why sattva avajaya is guna related treatment. Sattva guna improving treatment in the manas is sattva avajaya chikitsa. Okay. Not uplifting the other elements. That's why sattva avajaya is mentioned. Not the raja avajaya or tamo avajaya. It is specifically sattva guna of the manas to be improved, to improve the manas. Prakashakatva of the manas to be improved, not the other aspects of manas. Okay, that's why sattva avajaya is. Navaja is upliftment or improving. With the counseling etc., you are making the mind or the person's understanding better and improving, helping him to improve, because he has to improve himself, helping him to improve his sattva guna by these elements. And what's the another?
In Charaka Sutasthanam, along with how do you do this Sattva Chikitsa, that's what these techniques have been mentioned. We have Manaso, Jnana, Vijnana, Dhairya, Smriti, Samadhi. So Jnana refers to Adhyatma Jnana, like the Atmadi Jnana refers to the Jnana. Vijnana refers to the Shastra Jnana, like the specialized therapy that is done, like we have the cognitive behavioral therapy, the motivational enhancement therapies, all these specialized therapies comes under Vijnana. Dhairya, Anudata Chetasa, we are trying to give the supportive therapies, motivational enhancement therapies, they all comes under Dhairya Chikitsa. Okay. Then Smriti, okay, where we are trying to improve their Sambhasha Shakti, improve their ability to even forgetfulness also is a type of Vismana. Vismapana is also a type of Smriti. Especially the Samadhi. Samadhi, Yoga, Niyamana. All the application of Ashtanga Yoga can be done for the betterment of the individual. So all these therapies can be applied in different stages and different conditions of Unmada or the Manasyoga conditions.
Once again, in the Yuktiyopashraya, you have options, specifically while in the Dhritas itself, by seeing the gunas. Because Dhrita itself is Smriti Buddhi Vardhaka. And the gunas, the drugs which are used to prepare the gunas, they increase the gunas of that particular Dhrita. And for the particular dosha you can utilize. So here, see, even in the Bhutonmada also, some of the Dhritas are mentioned, like Mahapaishachika Dhrita, Kalyana Dhrita, it is Bhutopahata Chetasam he mentions. So if you read the Falashruti of all Dhrita, you can understand this Dhrita particularly where it to be used. Okay. So in each Dhrita or each preparation, the Falashruti is most important for application of that particular yoga. And even in the Rasayanas, many Rasayanas, it's the words, Falashruti starts with Smriti, Buddhi, like that only. So most of the Rasayanas and Yuvajikarana yogas, that's why it can be utilized, used in the Chikitsa of Manasyoga, or we are using them because most of the Rasayana yogas or Vajikarana yogas, there are also because in Vajikarana, the Sankalpa that is related to Manas. So if the Sankalpa to be improved means Manas should be improved. So that's why all the Vajikarana yogas also have effect on the Manas. Without having effect on the Manas, Vajikarana yogas cannot be successful. Okay. That's why most of the Vajikarana or all the Vajikarana yogas, all the Rasayana or most of the Rasayana yogas are effective in the management of Manasika Vikaras also. As per the Falashruti, you can utilize them in the Smriti Vikaras, Buddhi Vikaras, Mano Vikaras, or Smriti Buddhi Mano Vikaras, like that. Okay? And in the Dhritas also, some are in the Vata, some are in Pitta, some are Kapha, according to their Falashruti and the drugs which are there in the yogas.
Your question, madam? Why Chitta Vyapashraya it is not told? Sattva Vyapashraya, sorry, Sattva what they told, isn't it? Why they told Sattva? See, whenever you are studying in Ayurveda, the reference to context is very important. See, Chit and the other, the synonyms they told in different concepts, when it is associated with the Atma, the physiological aspect when they are explaining, they told the Chetana, which gives the motivation. The Atma, it is not involving any diseases. In first chapter only Charaka told, but it is the observer only, isn't it? But whatever the things will come, that will put a Chetana only, Manas only. Why it comes? Because it is Chetana, it is the movable. Atma, it is the silent factor. Isn't it? For this context they told Chetana. And when the Guna concept, Karma concept or Vishaya concept will come, here the Acharya has told Mano Vishaya, Mano Guna, Chit or Chetana or Sattva Guna he they told. Sattva, when the treatment aspect will come, Sattva Avajaya Chikitsa they told. Because what Sir told, we have to uplift the Sattva Guna here by different karma here. The karma means here, Mano Karma concept, the Manas you are used. The Chikitsa concept when it will come, particular to the Chikitsa to the mind, the Karma, the Sattva concept is used by the Acharyas. Here, for example, I will tell you, the three types of ahara they told in Bhagavad Gita, Sattvika ahara, Rajasa ahara, Tamasa ahara. Isn't it? Here, Sattva word is used by the, even in Upanishad, even in the Vedic script, even in Bhagavad Gita. Why it is? Here you have to uplift the Sattva Guna here, which will be promoting or increasing the Sattva Guna, that is Sattvika ahara, Rajasa ahara, Tamasa ahara. According to this the Acharya made, the Dana, Karma, Kartru, Shraddha, Bhakti, etc. The three divisions they told. Here Sattva word is used, not Manas or Chit. What is the Chit, Sattvik, Chit, Ahara, Chit, Rajasa, Chit, Tamasa not told. Sattva, Ahara, Sattvik, Ahara, Rajasa, Tamasa. To uplift the Sattva Guna here. I told you first in previous only I told you. To promote or to improve the Sattvika quality in the human, the individual, it is only the important treatment. The mitigation of the symptoms or the part of the eradication of the disease is not important. When the personality we have to increase or make the positivity of the personality or behavior when you will made in the individual, that is the treatment. That will be the 100% treatment. That is Vigata Unmadha Chikitsa. Then only you call it a Vigata Unmadha. In that condition only patient will understand the Atmaninam cha sarvashaha. When we are treating with ahara, vihara, etc. over, then the panchakarma over, then the other, the sattva is over. Later on, final stage, Atmaninam cha. Then he has to practice this daily. I should like this, I should be like this only, my ahara, my vihara, my activities, towards the society, towards the family, I should be like this only. He repeatedly, when he will start understanding himself, that will become the Atmaninam cha sarvashaha. In that condition only he will understand. Then here, automatically the Sattva Guna will be increased. But Raja and Tamo Guna will be present, it is not absent. Sattva Guna will be in peak level. But Raja and Tamo Guna it is required. To motivate the Sattva Guna, Raja Guna is required. Tamo Guna is also important. But they are present, but they are in graphically if you see, they are in the very lower graph. But it will be in the peak level, the Sattva Guna. Such individuals is having the Sattvika activities and Sattvika word. That also I told in Sutrasana they told. Apart from this, we told some questions you have raised. The Bhutagraha, can I conclude?
Just 1 minute, one word back. See, the famous Ramayana, who wrote? Valmiki. What he was earlier? Hunter. Where Rajatama was more. Who converted him? Narada. What he told? Just to chant Rama Rama. Rama or something. Okay. Rama chant. What was the result? Sattva came to the peak level. So chanting itself can change the personality. Okay, that's why even in the kaya, Sattvika, Rajasika and Tamasika kayas which are there in the society, the prakriti cannot be changed as there are, but kayas can be changed. A Rajasika kaya person by motivation, by Sattva Avajaya Chikitsa, he can be Sattvika person, Sattvika kaya. A Tamasika kaya person can be, that's why the modern people now, personality disorders, they won't have any treatment. Many times they ask, sir, what do you have? So, Sattva Chikitsa is a treatment for the personality disorders. But a difficult task. because all people won't come for the treatment. Okay, but treatment is there. Okay. Yeah.
Regarding the treatment and the symptoms of the diseases, many things we have discussed here, and you have raised some questions which are essential in day-to-day practice. That also you have to understand. The dosage Unmadha aspect we have gone more concentrated by the Narayan Prakash by analyzing the symptoms or the Nidana of dosage Unmadha he told. But apart from this, in Agantuja Unmadha also there is some important factors told by the Acharya Vagbhata. Some of the diseases without involvement of dosha also it will come. Later on the dosha involvement will be there. What are the such the one or two just I will highlight from the Avasthanusara. Regarding the Homa mantra etc. we have told many things. Why this disease should be Agantuja Unmadha will be occurring is the last two lines the Acharya Vagbhata told. Homa mantra balijjanam vigunam parikaramacha. It means you have done the homa, you have done the mantra, chanting mantra. Sir, now one the ಸಾವಿರ ಸಲ ಜಪ ಮಾಡ್ತೀವಿ ಅದನ್ನು ಏನಾಗಿದೆ ಒಂದು ತಿಂಗಳಲ್ಲಿ ನೀವು ಹೇಳಿದ್ರಿ. No. Why it is? Because of homa mantra balijjanam vigunam parikaramacha. In what way they told you have not followed this properly. The what in the textbook or in Sambhasha they told you have not done the homa mantra bali etc. You have not in proper way. That what you have not done in proper way, it is giving trouble to you. You have one side you have to perform or you have to follow the rules and regulation what they told. And one more important, ekasya eko ashucher devatarchadi parasutaka sankaraha ekasya shunye avasthanam. If you sit alone in one place, dark room, 2 to 3 days, sit alone, you will start getting the problems. Isn't it? Ekasya shunya avastha. See, this is very important. Here what is required? If you can give any idiopathic, no use. You have to tell him, you have to convince him. Isn't it? Such the Agantuja Unmadha, the Acharya's Vagbhata has given many concept. Chidra Papa Kriyarambha. What is this Chidra Papa Kriyarambha? What is this meaning?
Thinking again and again and
No, Chidra Papa Kriyarambha means when we seeking the weak point of others, if you are pinching him repeatedly, that he may not get much problem, but what we are doing, we get the many problems. Papaha Chidra Kriyarambha. This is actually the meaning. We will understand in different way. No. If you are seeking his weak point, if you are point out it repeatedly, time being he may get some little problem. But when we are doing this, the permanently we will get this problem. This is Papa Chidra Kriyarambha. But in a commentary, you read it, you will understand. Very fantastically, the Acharya has given the examples here. And Parasutaka Sankaraha. This is also very common. How it will come? That totally this category of the people will be 80%. I have done the examples. If you go for the Shava Sanskara, 10% of the people are strongly believer of this, 10 strongly opposer of this. 80% nor believer nor opposer. For example, if you go to the morning, if you die, up to evening you have to wait. 10% of the people, they will not take anything till this will be over. Then they will go home. They will take bath. Then they will take. Isn't it? 10% they will not at all believe. They will go to hotel and they will take. They are the strongly opposers. 10% strongly believer. 80% of the people nor believer nor opposer. ಇವರು ಕರೀತಾರಂತ ಹೋಗ್ತೇವೋ ಅವ್ರು They are calling, hey, since morning you are waiting, come, otherwise you will die. Hey, you should not go like this. Without taking this, you should not go there. Isn't it? Both the sides were confusion. Alivariko, we will go up to the hotel, but we will not take, we will take the tea. Oh, adunu puri like when after this, I should not take this at least, I should not take that tea or coffee along with them. I have done the mistake. This, what repeatedly it will come in your mind, it is causing the mental abnormalities. Isn't it? The 80% of non-believer, non-opposer are sufferer from the psychiatric illness. Strong believer, strong opposer. They will never get. Their mind will be very strong. Nothing will happen. They will leave it. Isn't it? Why this I told? The question will come. Bhuta, 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 etc. You have told. There is no Bhuta or Deva or the Pishacha, etc. Bhuta is a 4 types of it is only. Bhutanas Chaturbida Yoni, Jarayuja, Andaja, Swetaja, Navabhija. You have studied in the this. It is Bhuta actually. Not Bhuta means a ghost or devil or etc. Why it is? How it will be happen? In the symptoms of what are called, the modern symptoms if you compare, in Ayurveda if you compare, there is no difference, correct? There is no difference. The symptoms are the same. That will be, they are in English. Our classics in Unmadha Prakarana, if you go through the Unmadha Prakarana detail, the whole disease, DSMR 4, 5, 6 and whatever the category they have made the diseases in different category, modern people will get all the diseases in Unmadha, only one chapter. Then no doubt it is. Why it is? Because in only one word Acharya has told this. Lakshay Jnana Vijnana Vak Cheshta Bala Paurusham Purusham Apaurushe Ratra Tatra Bhuta Graham Vadit. What is this meaning? Lakshay Jnana. Sir told Jnana means what? Vijnana means what? Lakshay Jnana Vijnana Bala and Cheshta Vak. These are the 5 will become a normal individual. How much I can talk? I can talk 3 hours, 4 hours, okay. I can talk how many languages? 2 languages, 3 languages, 4. If I start talking some other language which I don't know Urdu, if I start talking, it becomes abnormal. It becomes abnormal, isn't it? My knowledge is, after my 30 years of experience, how much talk I should talk. More than that if I talk, it will be abnormality, isn't it? Activities, the bala, the strength, how much strength I have in, I should have some strength, isn't it? According to my the body weight and other body mass, whatever it is, I have some strength. If I have shown the beyond the limitation of my activities, beyond my limitation, it becomes a abnormality. This is a bhuta. Why it will be happening? Because of Sir told the mirror, your only shadow will come. The bhuta, Pishacha will not enter. That we are keeping in our subconscious mind. What Sir told regarding the modern concept also you should have the knowledge. Subconscious mind, it will be retaining what you are thinking. The thinking, it will be remaining. That will go back and existing the subconscious mind. When the conscious mind will be existing, you are showing these activities. This is the physiological concept behind it for these activities. The 3 people are sitting in the bus. One who don't look the first window side, middle and the last one. Window side and last, these 2 people are talking some subject. The middle who is sitting, he doesn't know anything. This was in Calcutta, long back it was happened. They are talking some the topics, which that middle who is sitting, he doesn't know. But when he had gone to his native place, he started talking that the language what they have spoken. Isn't it? What happens to him? If something happens to him, how it is? There is no question. All the 3 are come by same bus. Isn't it? Unique matra. What they were talking, with the subconscious mind, he has taken all the things and he has kept in his subconscious mind. When the subconscious mind has gone back and conscious mind is existing, he started talking in this way. Isn't it? These are the things. Na devaha, na gandharvaha, na yaksha. Why they told? Because of this only. Because of this only, the Acharya told, nobody will be entering, nothing will be happening. It is only our Pradyaparada. Finally, what I will conclude. Pradyaparada sambhute vyadau karmaja atmanaha na visamshiddhide devan na pitran na rakshasa. No ancestors, no god, no devil will be entering. It is our intellectual dustbin. Pradyaparada. What the Pradyaparada will do? That Pradyaparada is giving the shiksha or this is to our the mind and the body. It is only the important. And sir told regarding the importance of vata also. Indriyana manonato manonatastu marutaha. You know this concept. In Indriya also controlled by the mind. The mind will be the vata will control the mind. That is why the vata dosha you have to keep very much important in the diseases. Only in two diseases you have to give the importance to pitta dosha. Jaraha jaivati sareshu sarvatra anyatra marutam. Acharya has only told. Only in two diseases, Jara and Sara, you have to give the importance to pitta. Remaining all the diseases vata dosha only. And in Agantaja Unmadha, Acharya Vakkata told 18 types of Agantaja Unmadha. Only finally he told, only I am giving the 18 types of Unmadha here, which I know. But as the physician or the Bhutavidya Chikitsaka in future, according to the condition, according to the desha, kala, etc., you can give the name for different. Nowadays you can give the name for computer graha roga also you can give, isn't it? Some students they are having the extraordinary knowledge, isn't it? Beyond their limitation they have knowledge. That is computer graha roga actually again. And one the teenage girl, she came with me, sir told regarding the festival, regarding that I will tell you. She came with cutting all over his pants, 7-8 cuttings. I don't know. See, we know this. We are wearing the full pant and shirt. Why is he cutting here? I told her, no, sir, it is a fashion, sir. She told. Fashion. When we were a childhood, we know that see, these are the Graharoga. Their mind conditions. See, how you have to wear the without Hakobati, Sutti Hakobati, see, this is it has become a fashion. Isn't it? This is the Graharoga. That's why the Acharya told, according to the condition, you can give the name for the diseases. The Acharya has given instruction and authority to the Bhutavidya Chikitsaka. And the Bhutanmala it is by name only, not by entering of any of the ancestors or God. It is only by our the Pradyaparada only. With this I conclude and I thank the organizer for giving us the opportunity to speak two words which we know, which we don't have the practical experience. Here the authorities are sitting. Even though in front of them we have told some points. If anything we told good things, that is by our grace of the blessings of our teachers and the ancestors. And if you have done any the mistake or it is our part only. Thank you, Anand.
Thank you for the organizer giving me the opportunity to share my views with you, and I thank all of you for hearing us. And maybe as Sir told, we are not complete. We have a drop of knowledge of Ayurveda, so that we share. Maybe you can expand your knowledge by Samhitas, by Tadvidyasambhasha, and involving in the Tadvidyasambhasha parishad. Thank you, Anand.
Thank you very much. My slightly benefit. Nityam Dukha Ahara Vihara Sevi Samikshakari Visheshvasakha Dataha Samaha Satyaparaha Shamavan Aptopa Sevicha Bhavantyam.
It was truly an inspiring and insightful session we listened to, sir. I request Dr. Saurabh S. Kokatnur, sir, founder, Tadvidyasambhasha parishad, to facilitate the three academic speakers. Vaidya R Joshi, sir. It needs to be seated for a while.
Vayam Pratas Nanam Raghuva Namaram Supravachanam Guru Dhyanam, Padma, Dharma, Ramanam, Nati Mananam. They have no any expectation. They woke up early in the morning. Suhas Shetty sir might have woke up at 3 and started by 5 from Belgaum. Narayan Prakash sir whole day he is traveling. Again he will be traveling today. And Joshi sir also with his busy administrative work has travelled all the way from Hubli. All three have given their most precious time. They only mentioned if Nidra is not proper, then Unmadha may occur. So losing Nidra, they made all of us to have deep embedded knowledges of Unmadha from Brahadri, from the team of tadvidyasambhasha parishad. We wholeheartedly thank you, sir. And we expect all of you to